My name's Nilesh Vasan, the founder of Adroit Surgical. And one of the questions that we've got asked is, how could we use our Vie Scope in the COVID situation, where obviously airway management puts people that are intubating at risk. So, number one, you should have the appropriate PPE. Of course, you need to be protected. And second, when dealing with the airway patient in a potentially COVID positive situation, you want to be as expedient as possible. So whatever technique that you have to use, as long as you're proficient with it and you have first pass success, you're going to minimize your potential exposure to a virus. And I think everyone will agree with that. In a hospital setting, especially in Western countries, people advocate video laryngoscopy, and that's usually in like a hospital setting. Not everyone can afford a video laryngoscope. And second, using it out in the community or on the street becomes problematic. What can you do for a barrier? Well, I think everyone's seen those intubation boxes, which I don't think are in favor now, which was mainly a hospital tool. Other folks might use like a plain plastic sheet just to cover the patient, or the mannequin in this situation, and then underneath the sheet perform the intubation. So being familiar with the tool that you've got, picking the appropriate tool for whatever patient situation that you have, and being expedient with first pass success is key. So how could the Vie Scope help you with a COVID positive sort of situation or patient? Well, what we offer is first pass success. Remember, there is no evidence to suggest that video laryngoscopy is better. The whole idea behind that is trying to increase distance between you and the patient by using the video laryngoscope. The flip side, of course, is that using a video laryngoscope doesn't mean that you're going to perform the intubation faster. You might use it, you might eventually get the airway, but it might have taken you some time. So let's have a look at perhaps how the Vie Scope could be of some use in that scenario. Well, number one, there's no fancy technology. Here it is, a self-contained device. And the blue one is a demo scope. We use this for demonstrations and we can use this hundreds of times, whereas the device that we use on patients is a single-use device that needs to be disposed of, so there's no cross-contamination. With video laryngoscopy, it's an expensive piece of equipment, there's a lot of cleaning that needs to be done. Whereas with our device, you just have to toss it. So with our device, we want a straight line of sight as quickly as possible. So Mr. Mannequin has COVID, we have a plastic sheet, and they've been paralyzed, so there's no respiration now, so you've got to be pretty quick about intubating. So what we can do is have a look very quickly underneath the plastic sheet. I'm using my own eyeballs, I see the airway, I'm getting my bougie, and under direct vision I'm going to pass this tube, and I stop at the green, and now within a few seconds the airway is secured by the bougie. Note that I can sort of step back a little bit. The patient or the mannequin is still under the plastic sheet, and then we can pass the endotracheal tube. The endotracheal tube in COVID positive patients is important, especially if you're transporting them, because now you have a closed circuit and the risk of contamination diminishes significantly to anyone that might be in an ambulance or an enclosed space.